Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.
Hi, and welcome to Berks Community Health Center Presents. My name is Debbie Hartraft, and I am the Chief Community Relations Officer at Berks Community Health Center. This month's topic is depression. According to the National Institute on Mental Health, it's estimated 21 million adults in the United States have had at least one depressive episode. This number represented 8.3% of all U.S. adults. So to talk about depression and ways to get help, with me today are Jeannie Stephen, CRNP at Berks Community Health Center, and Kay Miley, an LPN at Berks Community Health Center, both at our Oak Brook location. So welcome.
Thank you. Thanks for having us.
Well, thank you so much for joining me. I really appreciate it. And this is certainly a very important topic. I know personally I have loved ones that suffer from depression, and I think everybody pretty much does, especially when you learn that 8.3% of all adults suffer from it. So why don't we just start with what is depression? And I think we do have a slide to help us with this.
Yes, so depression, it's really a disorder. It's a disorder that makes you feel sad, a little different than the normal kind of sad feelings that you might feel intermittently throughout the day. Depression, it lasts longer. It can last longer than about 2 weeks. And it really kind of makes you hard to do everyday tasks, to work, to study, just to complete tasks of everyday living.
Wow. And what are the causes?
Well, there can be a lot of different causes of depression. So basically,
advance the slide, sorry.
Depression is basically, it's a chemical imbalance in the brain. It's when the neurotransmitters just kind of aren't functioning properly. Lots of different causes of depression. If you had a medical illness, say if you had emphysema, it makes it hard for you to breathe, just complete everyday tasks. Something like that illness could cause depression. If you had chronic pain, or if you really had any chronic medical illness that it's just lasting for a long time, it can lead to depression. If you were a child that suffered from abuse, as an adult, you might be a little more prone to getting depression. Mm-hmm. Other things would be if you had a lot of family struggles, if you had struggles with in relationships, with families, with work struggles, all of those can lead to depression.
So I was imagining they feel a sense of hopelessness, and many people do suffer from some of those things you mentioned, but don't suffer from depression. Is it beyond that? Is it a genetic thing? Is it hereditary?
It can be, yeah, definitely. If you had parents that were prone to depression, mother or father, then you are going to be maybe a little more prone to having depression as an adult.
So you mentioned earlier, sometimes it's just sadness, but it doesn't go on for an extended period of time.
Right.
That's the difference.
Right. That's basically the difference with depression versus just some like intermittent feelings of sadness. Like if you had the loss of a friend or a pet, or going through a divorce, something like that. Depression is more when you're feeling down for a period of more than 2 weeks, and you don't really enjoy doing the things that you normally would give you pleasure. You just don't feel like doing them. For example, like if you like to garden or bike, or if you liked going for walks, shopping, anything like that that you would do to make yourself feel better. You just don't feel like doing it.
Okay. So those are some ways that you can know that you're going through depression. Are there any others that you know that it's not just sadness, but you need to seek some help?
Yeah, there's a host of symptoms that go along with depression. I mean, you can have feelings of just very tired, you don't want to get out of bed in the morning, or you could be the opposite end of the spectrum where you experience insomnia and you have trouble sleeping. Other symptoms could be eating, if you just feel like you want to overindulge and eat more than usual. And then again, you might also feel like you have no appetite. You would feel more tired, less energy. And then on the other end of the spectrum, you also might feel easily agitated, kind of cranky feeling. So those all go into, they all kind of fall into the spectrum of mild to moderate depression. It's really when you start feeling more severe symptoms of depression. If you were having thoughts of death or self-harm, then that's really when you want to get more help right away. So there are lots of resources available for people that really are feeling those thoughts of self-harm.
So how do they diagnose depression once you do see somebody?
Yeah, actually at Berks Community Health Center, every time we see a patient, we actually go through a depression scale. It's called a PHQ-9 scale. So it gives us kind of a range of how a person's feeling. And I think Kay has that scale here.
Sure. So this is a questionnaire that you most likely seen at one of your recent healthcare visits, but there are 9 questions that we'll either go through with the patient, or sometimes the patients will have it on a laptop or the paper so they can fill it out in privacy. But the questions are little interest or pleasure in doing things. It's basically asking if you've lost the interest or the pleasure, as Jeannie said.
Are these yes or no answers?
So when you're filling it out, it's going to ask you the questions, and if you have the symptoms, it'll ask, do you have it not at all? Do you experience this several days, more than half of the days in the last 2 weeks, or nearly every day? And it goes through these questions, and it looks at a 2-week period, and if you're triggering responses for these questions, that's when your provider will have a more in-depth conversation with you about what it is that you're going through and how we can help you.
Right, right. What are some of the other questions?
So it asks if in the last 2 weeks, are you feeling down, depressed, or hopeless? Are you having trouble falling asleep, staying asleep, or sleeping too much? Are you feeling tired or having little energy? Do you have trouble falling asleep, staying asleep, or not sleeping enough? It asks about appetite and overeating, as she said. Trouble concentrating on things and focusing. It asks about restlessness, if you're fidgety or restless, or are you moving slowly and speaking slowly, like monotone? And then the last question is, we do directly ask if you have thoughts of harming yourself, thoughts that you would be better off dead.
So our patients at Berks Community Health Center complete that form, and if they indicate that they do have some of these symptoms, what's the next step?
So depending on the scale, so what we do is we go ahead and add up the scale and on the total, and then there's actually depression severity. So, if you score 1 to 4, you have minimal depression. And then the scale ranks all the way up. If your score is 20 to 27, then you would have severe depression. So there's a lot of choices. So at Berks Community Health Center, if you're falling into the mild to moderate range, we would refer you to, we have behavioral health specialists that are available. Also, just seeing your primary care provider is an option, and and talk about how you're feeling. And some other treatments.
So you could also be referred to a mental health provider outside of your PCP's office. For more severe cases, we would use the Lifeline, the crisis hotline. There's two options here in Berks County. There's actually a center over in West Reading on Buttonwood Street where they channel their local crisis calls, and they have a direct phone number. That's more of a phone number that healthcare workers may call, or you may find yourself calling for somebody else, but the public can use it. And that phone number is 610-379-2007. And we also have a newer lifeline that a lot of people don't know about. You can dial 988 from a cell phone or a landline phone. You can also send a regular text message to 988. And that will go to our crisis center, and they have operators available 24/7 to speak with and offer support. They can help you determine if you need immediate medical help. They could help call an ambulance. They have workers that can come out and meet you and talk to you if you're not comfortable going with the next steps. Or you can just use it to chat. One interesting thing I actually just learned about that today was for the LGBTQI community, this 988 hotline that you can chat or call offers 24-hour support as well for mental health issues that.
Wow. That's a tremendous resource that probably a lot of people really don't know. So 988.
988. You can dial it or you can send a text message.
So let's say somebody is diagnosed with depression. What are the treatments?
So you want to start with, it's kind of a dual treatment. So what you want to do is, the best thing to do is get in with a therapist. So you could either your family provider can offer some support. You have behavioral health, which we have at Berks Community Health Center. We can also help to refer you out to a psychiatrist, psychologist, to start with some talk therapy. And then in combination with that, there's medications. There's a lot of different medications that you can try to help to boost your mood and help kind of get you out of the depression. Other things that you really want to do for just self-help for yourself is you really want to make sure that you get enough sleep. Try to exercise, even if it's just going for 15-minute walks every day. Go out and get some sunshine. And really make sure that you have proper diet, you're getting enough sleep at night. That's very important. So all of these things can help to reduce the symptoms of depression. And when we talk about depression, it's really considered a mood disorder. It's very common between depression and anxiety. It's one of the most common mental health diagnoses that we treat at Berks Community Health Center. And
I was going to ask that. Do they usually go hand in hand, anxiety and depression?
They do, yes, they do. And it's kind of a stigma when you talk about mental health, that people feel like they have to just kind of hold things inside, and they might think, well, is there something wrong with me? And it's, maybe looked down upon to admit that you have some depression, but by all means, reach out to your provider. That's what we're trained for. That's what we're here for, to give you the help you need. And we feel like in this day and age, with so much going on, you watch the news, you watch social media, and there's so much conflict. And it all kind of can build up in you, and before you know it, you might have these subtle symptoms, like Kay was saying, just feeling tired or fatigued, and you kind of have to step back and say to yourself, well, you know, why am I feeling this way? Is this really, do I just feel tired for a reason, or, you know, am I really depressed? So these are all great discussions to talk to your family doctor about and make that appointment.
So if they do seek help with their primary care provider or whoever, how long does it take for them to feel better? When will they see some kind of result from it?
Well, that's on a case-by-case basis. You know, the important thing is taking that initiative to talk to somebody and get help. And then, you know, if you choose to go with medications don't work overnight. Medications for a lot of mental health problems take time. So that's one thing that, you know, maybe patients would like to know beforehand, is if you're thinking of medication as a treatment option, it's a process. You may need to go through several medications until you find the right one.
I was just going to say that.
3 to 4 weeks till it's therapeutic.
Yeah, yeah, wow.
Yeah, and also for severe depression, so if you're really severely depressed and you're having thoughts of death and thoughts of self-harm on a daily basis, you could also want to think about some inpatient therapy, you know, getting into a hospital, psychiatric facility where they can provide the counseling and the treatment that you deserve, really.
Right.
Because when you think about mental health, you know, we talk about anxiety and depression. I mean, it's truly a chemical imbalance in the brain. It's a problem with the neurotransmitters in the brain, and sometimes it just kind of takes time to get them rewired.
Right.
And when you think about it, it's if someone were diabetic, you would get treatment. If you had COPD, you would get treatment. You would take your medication. So just like any medical illness, your mental health it goes hand in hand with medical treatment.
I hope we're overcoming that stigma, because absolutely,
Yes.
I would think we are. We're not quite there yet,
Yeah.
but it does seem like there has been some improvement in that regard. So I hear a lot about the winter blues and seasonal depression. Tell me a
Yes.
little bit about that.
Yeah, so seasonal affective disorder, it's very similar to depression, but it happens more with the change of season. So you're going to see it more in the winter months, and it kind of makes sense because it's cold outside, the sun's going down early, you feel like you're just not having just really that sunlight. It kind of really helps our mood. We have gloomy days, we have a lot more cloudy days, so it can build up in people, and you just feel depression. It's really seasonal depression, but it occurs more in colder months. It can occur in different seasons as well, but typically we do see that in the winter, and the treatment is pretty similar, and I would say if you talk to your provider and tell them how you're feeling and get the therapy, see a behavioral health specialist, and think about starting on medication if you feel like that would be a good option for you. Other really great things to do, especially in the winter, you know, if you get that nice day, really take advantage. If it's even on your lunch break, you're at work, and if you can just go for a short walk. There's also light therapy treatments.
Really?
Yeah, that can be done. People are just need to be exposed to the light, and it helps to brighten their mood. But
Wow.
very, very similar symptoms to depression. So you're feeling tired, you feel like you don't want to get out of bed, or you might have insomnia, you might want to overeat, or again have lack of appetite, little interest in doing things. So very similar to the symptoms of depression, but just more seasonal.
Yeah.
Yeah.
Wow.
But lots of treatment is available.
It's not one of those things that you like, just gotta wait till spring. Just hang in there.
Yeah,
There
yeah,
really
don't-
is something that you
Yeah,
can
don't
get
wait till
treatment.
spring. Go ahead and get that appointment with your primary care provider. Tell them how you're feeling, because there's lots of treatment and you shouldn't have to walk around feeling blue all winter long.
Right.
Yeah.
Wow. It's really fascinating, and it's, like we said, so many people are suffering from it, and it's good to know about the resources that are available, you know, from your primary care physician as well. You know, I'm thinking some of our viewers might not think to go to their primary care provider for just feeling tired and blue and, you know.
Right.
But absolutely is a resource.
Yeah, and it's just going to your primary, and first of all, what you want to do is, you know, you're going to get your physical, and there could be other reasons for the fatigue that you're feeling. So your primary is going to, you know, do a physical exam, get some blood work done, maybe check your thyroid, check to make sure that you're not anemic. Other medical causes: is your blood sugar stable? Is your blood pressure okay? So really just seeing your primary care and getting that full physical, making sure there's nothing medical going on, and then going on to the next steps.
Wow.
Yeah.
Is there anything I didn't cover regarding depression? We have just a few minutes left, but I want to make sure we cover everything that's available.
I would just mention that I agree with Jeannie. We think going through the PCP, talking to your family doctor first, is important because it can rule out other causes, but you don't have to. Most mental health services, you don't need a doctor's referral. If you are insured and you call the member services number on the back of your card, most health plans have a special department just for that. And also don't forget, if you're an employee, if you work and you have a job, it's most likely that your employer offers an employee assistance program that a lot
That's a
of
good
people
point.
don't pay attention to.
Yeah.
A free service for anonymous counseling or talk therapy for a situation that may turn out to be temporary, or it could lead to ongoing services.
Yeah, and I think you have a good point there. It is totally confidential. The employer does not know that you went. They just know, from what I understand, the number of employees that use the service, but not the names, not the conditions or diagnoses or anything. So that's a really good resource.
I like to remind my patients about that, because sometimes what deters people from getting help is the copays for specialists.
Right.
So check with your employer if they have an assistance program that you may not have to pay a copay.
Wonderful. You mentioned the behavioral health specialists at Berks Community Health Center. Can you tell me a little bit more about those?
Yeah, sure. So we have a couple of behavioral health specialists, and they are trained in the mental health field. And if, for example, if I have a patient come in and they are displaying signs of depression, we can easily put that referral in. And it's very nice because within Berks Community Health Center, we do have the ability to get the behavioral health specialist on board, and they come to all of our locations. We have 4 locations now. Well, with the mobile unit, now we have 5.
Right.
And they have that ability to actually come in personally and speak to the patient and see what they're feeling. And if behavioral health feels like the patient is going to need extended treatment, they can also assist them in getting into some psychiatrists that are in the area. So we have a whole list of mental health providers in the Reading area that can offer assistance. Say, if the patient does need something more than talk therapy, something more than just the routine medication that the family provider can give. So lots of resources available, and there's a lot of resources available in Reading as well.
That's wonderful. So before we end, I think it bears repeating, if you are thinking of harming yourself or thinking about death, there was a number you gave Kay that you can call.
You can dial 988. You can send a text message. What's most important is talk to somebody,
Yeah.
anybody.
So 988.
988.
Thank you. Thank you so much for joining me today and talking about depression. And I really do believe that there are so many people suffering from it, and some maybe don't even know they are. They just know they don't feel right. So I appreciate all those symptoms, and just if you're not yourself, pretty much, talk to your primary care provider. Please get the help that you need, and if you need further help, as they mentioned, they can refer you to a specialist for further treatment. So, well, thank you so much for joining me today, and I appreciate all the times you guys come back. You're a dynamic duo, and hopefully you come again in a couple months. And thank you for viewing today, and I hope you continue to watch Berks Community Health Center Presents, and we'll see you next month.
Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.